The human circulatory system is a miracle, but behind that miracle lurks a silent killer that causes more than 350,000 premature deaths annually. It affects almost 1/3 of the U.S. adult population and more than 670 million people worldwide, resulting in annual costs of more than $66 billion. That silent killer is high blood pressure. Hypertension is a huge global medical challenge, with 50% of the cases going untreated because it is asymptomatic. Treatment is a challenge. Drug therapies can cost $1,200 a year and require multiple oral medications, most with very unpleasant side effects. And when heart attacks and strokes strike, they are life-changing events that deeply affect the patient and the people around them.
7 years ago, my cardiologist discovered that I had a hole in my heart. It's called an atrial septal defect. The hole in my heart was 1 inch long, and it had to be repaired. That after they closed the hole, my blood pressure increased. Medications are difficult because they're expensive and they have side effects. So I was looking around for some solution to my elevated blood pressure.
Hypertension is a significant problem, and it is used for assisting patients with high blood pressure without the use of pills.
The mechanism of action of this device, first of all, it's the cold tip application when it's applied to the carotid sinus in the neck.
With the PhysioCue device, if I apply it to my carotid artery for 5 minutes a day, it almost automatically drops my blood pressure by 20 to 25 points.
It turns out that your carotid artery, you have carotid baroreceptors that with pressure, they decrease your systolic blood pressure and decrease your heart rate. What's really interesting about it is that this tip gets cold and you place it in your carotid for 5 minutes once a day. And we have seen a progressive reduction in.
Using the PhysioCue device, my quality of life has really improved, if only because it's more predictable now. It's normal. I don't have big fluctuations in.
Here's a graph showing a typical patient's experience from our initial clinical study. The steady daily rate of progress is clear, with an almost 35-point drop in his systolic blood pressure over 68 days. Studies have shown that with just a 10-point drop in systolic blood pressure, there is a 22% reduction in the incidence of coronary heart disease and a 41% reduction in strokes. PhysioCue is now conducting additional clinical studies in the United States in partnerships with several luminary medical institutions.
Our initial clinical study showed that 87% of the study population had a moderate to significant reduction in their systolic blood pressure. PhysioCue 2.0 device is revolutionary. The fact that they've incorporated biosensors, and you place a thumb on each one, and this will immediately not only monitor your blood pressure, but also gives you a beat-to-beat variability reading.
My medications cost about $200 per month. The PhysioCue device only costs about $300 one time.
This is a non-invasive device that can help your hypertension in a very safe manner.
So I love the device. Everyone we show it to loves the device. And we want to get it in the hands of many more people.